The topic for discussion at present is coracoacromial arch and its clinical relevance. Coracoacromial arch is an osteofibrous structure which is formed above the shoulder joint. It functions as secondary socket for head of the humerus as it prevents its displacement. As regards its formation, it has got three components. These are acromion process, coracoid process, and coracoacromial ligament. First, the acromion process. It is a large, somewhat triangular or oblong process of scapula which flattens from behind forward and projects first lateralwards, then curves forwards and upwards, and ultimately overhangs the glenoid fossa. Its junction with the spine of scapula is named as base of the acromion. Acromion forms the summit of the shoulder region. It has got two borders, medial and lateral, two surfaces, superior and inferior, and a facet for the acromioclavicular joint. Second is the coracoid process, which is a thick but a small hook-like process attached by its base to the upper part of the neck of the scapula. At first, it runs upwards and medially, then becoming smaller, it changes its direction and ultimately projects forward and laterally. The third component of the coracoacromial arch is coracoacromial ligament. It is a strong truncated triangular fibrous band which is present between coracoid process and acromion of the scapula. At its apex, it is attached to the summit of the acromion just in front of the articular facet for the acromioclavicular joint. The base of this ligament is attached along the whole length of the lateral border of the coracoid process. As regards the structure of coracoacromial ligament, it consists of two marginal bands with an intervening thin portion. At one end, both these bands forming apex of the ligament are attached at acromion, and at other end, both these bands separately form base of the ligament which is attached at lateral border of the coracoid process. Now let us have a look at the clinical anatomy relating coracoacromial arch. This arch forms a vault which protects the head of the humerus. It functions as secondary socket for the head of the humerus as it limits upward displacement of the humeral head. There is a gap between the coracoacromial arch above and humeral head with greater tuberosity of the humerus below. This gap is named as subacromial space. It contains subacromial or subdeltoid bursa along with tendon of the supraspinatus muscle. Subacromial bursitis is an inflammatory condition in which pain is felt in the shoulder region along with tenderness at the tip of the shoulder in adducted position. This tenderness disappears in the abducted position, and this disappearance of pain and tenderness by displacement of the subacromial bursa is named as Daw-Baron's sign. Supraspinatus tendon injury may occur spontaneously. If it occurs, this may lead to the degeneration of the tendon, hence inability to initiate abduction as supraspinatus is responsible for initial 15 degree of abduction. Comments and suggestions will be welcomed. Thank you for listening and watching.